said already, I do have migraine since I'm about 4. Definitely changed a lot in the symptoms I experienced. So as many of you with your children, or you as a migraine patient yourself, might know that symptoms can change a lot, especially from being young to becoming an adult, where we have different symptoms that are more prevalent. So especially in children and teenagers, abdominal pain might be a symptom that is more prevalent than the kind of headache that everybody knows migraine about. It's definitely not just the headache. And I experienced a lot of different symptoms, also have them change over time. So having to adapt and having to learn again, what does this new symptom mean to me? Are there new things I have to be careful about, to avoid, or how to manage those symptoms? So I've gone through a lot of changes, but that makes me very passionate to share that with you. Also, I do have a background in mainly product design and communications, and that's where kind of the connection came from, working with a lot of healthcare professionals who also develop an app that supports especially teenagers, but basically it's usable for everybody, from kind of very young kids together with their parents, through teenagers to adults. So I'm using it myself as well. Basically something that helps you to manage pain. And I'll go through that in a few slides in a bit more detail. It's really a first version. So we're still looking for feedback from people who have migraine. And yeah, you can just download it for free, test it. There's still some smaller things, but it works, and eventually it can help you already. But now I want to jump right into it. And the topic I want to focus on today is the so-called biopsychosocial model. That sounds a bit complex. It says that when we have chronic pain, migraine is a form of chronic pain. So chronic pain is pain that comes back again and again. And when we have that, then it's not just physical pain.
Sorry, Nicola, you're starting to break up a little bit.
Okay, I'll try to stop my video. I hope it's better this way.
Yeah.
So quickly repeating, this biopsychosocial model is a model that is used in pain management. Basically, what it says is that it's not, when we have chronic pain, it's not just physical pain, but also means that it brings with it emotional challenges and social challenges. So here is a very research based graphic for you to visualize that. And it's something that a lot of people don't know, or that is not communicated in migraine care, especially for young people. So you, together with your child, you as somebody who has migraine, just goes to the doctor to manage physical pain. And there, what is missing is the psychological aspect. So how we cope with the pain, how it impacts us socially, how we are impacted in our school environment, with our peers, with our friends, and all of this, again, interlinked with each other. So if we have a stressful day at school, how does it impact physical pain? Or how does physical pain impact how stressful a day at school might be? And I think this is kind of the core message, or one of the core messages for today, is that especially when we look at migraine in children and young people, that we shouldn't only look at symptoms, and that we shouldn't only look at those specific triggers of maybe one ingredient that might be the trigger for every migraine attack, because that's usually not the case. There's so many factors involved, and also so many soft factors, if we want to call them like that. So emotions, mood, how our day went, activities we did, and how we felt about them, how we thought about them. And that's a very important part, and also has been proven. If we look at all these 3 areas, so at the physical pain, at the emotional well-being, and the social well-being of children with migraine, it can help far better than if we only treat migraine with medication. And I cannot cover everything today. That would probably take too much time. But what I want to focus on is the psychological aspect, really how we can at least start with coping with physical pain better, how our mood, but also topics like anxiety, depression, which are very prevalent in people who experience chronic pain or migraine, how this affects us and how we can start to tackle them, especially from the home setting. So in a self-management model, and if there is no other support. But of course, if there is other support needed, if there is a psychologist, a psychiatrist needed, then of course, look out for them, ask your GP to get referrals. It's nothing to be ashamed of or to be thinking, okay, it's physical pain, so why should I need a psychologist? Chronic pain definitely means that our emotions and our emotional well-being is impacted as well. So starting from that, many of you might have heard from CBT, which is cognitive behavioral therapy. And basically everything it says is that our emotions, our behaviors, and our thoughts, and what is missing in this specific cycle for, if we apply it to migraine, our physical well-being, are all interlinked. So it's kind of a bit the chicken and egg problem. We cannot say that physical pain, so a migraine attack, always triggers negative emotions. So it might be that your child or you experience a migraine attack and on a good day might be able to cope with it very well, might be able to fall asleep quite quickly. And so there's no huge impact on your emotional well-being. But on another day, it might be totally different. And the same the other way around. So you might be very emotional, you might be very stressed about a certain situation, or even with positive emotions, you might be very excited about something. And you then engage in, let me give you an example. So for me as a child, this was always the case for school trips. So I was super excited, like the 2-3 weeks before the school trip, everybody's talking about it. It's yeah, everything is planned and you're really excited. But then the one day before, I get super anxious because all the thoughts came up around, what if I have a migraine attack during the school trip and my parents aren't there? So these thoughts, all these thoughts I had around what could happen. So what if, hugely changed how I felt about the whole school trip and how I behaved. So I was kind of ashamed that I was so excited before, and now I'm afraid. So I hid in my room. I didn't want to talk to my parents about it. So it hugely impacted my behavior. And then, of course, a lot of stress came up, a lot of tension came up. And often this actually led to my attack. Although, and this was kind of a school trip always leads to an attack. But that's actually not the case. It was all the things that happened before, thoughts I had, the emotions that changed a lot for me. So that was really kind of, there you see this vicious cycle, which isn't kind of a cycle, but all interlinked with each other. And that's something we have to look out for, that also the way we think about our migraine, the way we feel about having a migraine attack at school, when you're at a sleepover, these are also challenges that as a young person, also as an adult, of course, but especially as a child or teenager, we experience. So that's also something we have to look out for. I'll quickly jump to the app actually, because it's one thing we really want to focus on. So many of you might have been asked to keep a pain diary, a symptom diary that helps that helps a neurologist to understand any potential triggers, to understand what exact symptoms there are, to understand what the diagnosis might be. And there are already online tools, there are apps out there that help you, kind of as you see in the first part, to understand physical pain. But the challenge is, you as a person, as a child, as a parent, you're also looking at these only physical kind of hard facts. Okay, this is the physical pain you're feeling, and that's all there is. The problem is that we are missing the emotional, mental health component of what chronic pain actually means. So kind of what is important and what we wanted to incorporate, and why kind of one important why I wanted to include that is because I know from my own experience that emotions and activities are also hugely impacting the physical pain. So this is what we try to combine. And again, if you want, you're happy to try it out. There's no cost involved or anything. What we did is we look at physical pain, but also we look at your emotional well-being and connect them. So really showing in the end, okay, look, you recorded a migraine attack, but also look at what you did, how your mood was when you did these activities. Building this awareness, and even if you or the app or whatever, even if you keep a paper diary or no diary at all, this is something to start looking at and to try to highlight that when you try migraine, when you talk about migraine or migraine, always look also on the emotional component and try to figure out, try to discuss, because it's even for adults, and how emotion impact our physical well-being, because it's really tricky sometimes to spot how we're feeling. So I, through communication, talk through that and highlight that to build this awareness within the family, within your child, and how pain and how emotions are connected. So yeah, simple thing kind of that you started, so really looking out for activities, but also for mood before, after migraine attacks, during migraine attacks. So trying to understand the thought patterns. So really asking again and again, how are you thinking about this now? What are you feeling because you are having a migraine now? And you might identify some things, like for me with the school trip, that I was just afraid and I didn't know what I should do when I have a migraine and my parents are not around. So this helps you to find more solutions. For me, it was, I had this amazing teacher, and we sat together with my parents, with the teacher, and really walked through the steps, what should happen when I have a migraine attack. And this solution came up because my parents tried to understand really what thoughts are happening around the actual physical pain. At the same time, tackling stress before it can become a trigger. Highlight the stress here because we know that stress is a huge trigger for many people, for many young people as well, who experience migraine, especially in the phase of puberty. A lot of changes with your body, your friends, your school environment. So there are a lot of changes that can impact you a lot. And it might be positive stress in some ways, but still it's often taking on a lot of things and trying to be part of everything and leading to stress. And by looking at for example, tracking your emotional well-being, your mood, you can also spot that before actually it leads to pain. And the third, as I mentioned before, really having conversations about how pain, emotions, thoughts, and behaviors are linked. And yeah, if anybody needs more material on that, so there's some worksheets around that from cognitive behavioral therapy, you're welcome to always reach out, and I can try to send you the resources that are needed. As the next step, I wanted to look a bit into self-management techniques, and they are part of cognitive behavioral therapy, but it's not the full concept of cognitive behavioral therapy. So if you ever heard of CBT or even tried it, then this is usually a therapy that is done with a therapist, where you have about 10 sessions in a very structured manner. But as we know, that it's not accessible for everybody. So there are often waiting lists. It's quite far away, time consuming. There are tools and techniques you can home, and I want to look at a few of them, mainly on the part of relaxation. So just to recap, the therapy I'm talking about is cognitive behavioral therapy, so CBT, and it has these two components of first cognitive, which are basically where you learn skills to manage stress, where you communication and relationships. So a few of those points we touched upon today. So encouraging really you as a parent, or also you as a child, as a young person, to communicate with each other within the family, sharing any concerns you are having, even if you're not having physical pain, if you're not having a migraine attack, but any thoughts you have around what would happen if I'm in this situation, or I'm anxious because I think this situation might attack. So talking through these things, and I'm quite difficult. I myself had a lot of difficulties talking about my, not so much the physical pain probably, but more the emotional component and how it impacted me emotionally, how anxious I was because of my migraine. So really this encouragement of communication around physical and mental health is important. And also part of the cognitive area of cognitive therapy is learning to think about pain in new ways. So reframing kind of in your thoughts how you think about pain, how you approach pain. And although I won't give you kind of a full structured CBT exercise now, I want to kind of pass on one thing I've been working with a lot, is using a metaphor to talk about migraine with young people, or even with my own migraine, to be honest. And the way we see that at Happyr Health, so also in the app, is that we see chronic pain, that we see migraine as a dragon. So if you yourself live with migraine, if you have migraine attacks, you probably can quite well imagine this huge beast, or even tiny beast, when it's in really certain specific areas of your head, of your stomach, wherever you're feeling. But imagine it as kind of a beast, a dragon that comes back again and again, visiting you and leading. And the way we see it, that yes, this is a beast, but it's a beast that we can tame. So just if you have difficulties, if you struggle talking about this because the child might not want to talk about it, or it's hard for both of you to find words to describe it, try to think of a dragon. You can even draw the dragon, you can sketch it and see, or you can kind of get super creative around it, visualize the dragon, have it as part of the discussion. Have your child or even you talking kind of or communicating with that, showing, okay, it's okay to ask your migraine, why are you here? Or what is a challenge we are facing now? What can I do to make you a bit calmer, to make you a bit more relaxed? So this very visual support might help in kind of building this communication, but also improving the relationship you and your child have towards migraine. And the second part of our behavioral technique, and there the main focus is on deep breathing and relaxation. managing sleep problems, which are often occurring, increasing physical activity, and I'll come back to that in a second. And also CBT works a lot with reward systems. So setting goals and working towards them with a reward system you together with your child, often together with a therapist, are discussing. Before I jump into a few of the relaxation and breathing techniques I wanted to highlight, I want to talk about the part of physical activity. This is one part which is really difficult often, especially for parents, because what it says is that you should encourage your child to be active, not necessarily kind of exercise and sports, but doing normal tasks, living a normal, keeping a normal daily, like doing some chores, getting up for breakfast, not staying in bed for that, things like that. So encouraging this activity despite the pain. So there's a huge kind of disconnect where you think, okay, you want to protect your child, you believe them that they are really in strong pain. And that's definitely right, because pain is very, very subjective. If they tell you they're in really strong pain, then the first thing is, of course, believe them, talk with them through it in terms of a challenging experience. But still, this encouragement of keeping physically active or having an active day is very important from a psychological perspective. And actually, funnily, it's not found so much in adults, but especially for children and teenagers, they have to be active before they get better. This being in their daily routine, in what they know, in not kind of focusing on the pain all the time. This is so important to get back into this routine and not focus on the pain. So that's something, although very difficult, and of course you shouldn't push your child to do things they're not feeling, but encouraging them to keep up with a family routine, keep school as much as possible, of course. That is very important. There, just collected a quick statement, so you know that all I'm talking about is not just something I'm making up, because meditation, relaxation is in everybody's ears at the moment. That CBT, cognitive behavioral therapy, is often even better, a better treatment for headaches and migraine in children and adolescents than medication. And there you also see kind of 1 in 2 children with headache, and this is kind of the overall term of headaches, and migraine would fall into that, benefit from cognitive behavioral therapy. So if there's something you haven't explored yet, there are a lot of different ways. So there you can start at a very low intensity. There are more apps, there are online resources, there are books you can look at. But if you explore that in a deeper setting, then definitely talk to your GP, look out for mental health services who could provide you with contacts to experts to just try it as an option additional to medication. Now the part I want to focus on is how relaxation can help, and going through just highlighting a few relaxation techniques that are commonly used in cognitive behavioral therapy, in pain management, and stress management. And as we said before, relaxation can help a lot because stress is often a very strong trigger. Also, relaxation techniques help in building physical and emotional awareness. So again, coming back to what we talked about with the diaries, with the app, that you look at physical well-being, but also emotional well-being. And by engaging in these techniques, you learn better to spot any physical issues, any tension in your body, but also certain emotions you might not have spotted that easily before. And relaxation can help in controlling our rest and relaxed response. So this ties in with kind of the awareness. The more we are aware of being stressed, of being anxious, of being frustrated, any emotion basically, the better we can respond to that and also relax physically. And relaxation, of course, it's not everything. As we saw in the graph at the very beginning, healthy habits are all important. So that includes sleep, diet, exercise, and many other things. So I'm not saying this is everything and will help with getting rid of migraine. I'm saying that it is a really important part to include in the whole treatment process. And although this is probably not a scientific statement, but from my own experience, I can also tell that this has helped me a lot with my migraine attacks. So I'll jump through a few techniques, not in too much detail, but there are a lot of audio exercises available on, for example, YouTube, but you can also reach out. I'll put my contact details at the end for any specific exercises if you haven't found suitable ones. So just really highlight what's out there. And one back here, one very important one is belly breathing, which is officially known as diaphragmatic breathing. And this is basically to our bellies, where really you feel the belly rise and expand, holding the breath for a few seconds and breathing out again. And there's a very nice technique, I believe, for children or people, or also for adults who have difficulties with this technique. Putting your hand on your belly to really feel how you're breathing, to feel your rise and relax again, is to put, for example, a toy on your belly. So really visualizing, supporting this visually, how your breath moves into your body and out. And this also brings a bit a challenge of balancing it, so keeping a very regular breath, a rather slow breath, so that the toy doesn't. Second part is meditation. So meditation, there are different types, but mainly meditation, so really a practice to calm one's mind and body. And there's just a few tips. I mean, it's often easier to use audio guides, as I put there as well. So the best is usually to check on YouTube or check available resources. And again, reach out if you need some finding them and really figuring out what voice is suitable for your child or for you, what kind of pace of the meditation, what kind of duration. But really to highlight what is important there is that meditation is not about having a blank mind and not thinking about anything. So it's really about having thoughts during the process of being in a meditation and saying that is okay. So not kind of yourself and kind of being angry with yourself if you have thoughts. And this might be also a thing if you're doing a meditation together with your child, to highlight that, to talk through that before or after. And when thoughts are coming up, really acknowledging them and saying, okay, I'm having this thought now. I'm taking a second to have it, but then I'm coming back and I'm coming back to my breath or to my meditation practice. The next one is guided imagery. It's a bit like a story you're telling to create soothing images in your mind. And this is often, again, with an audio guide, but I can also share some scripts with you where you focus on all the different senses. So you talk through an experience, and there it's really nice to also create these scripts based on your child, based on their preferences. So for example, one option would be your garden. If your child really enjoys being in your garden or in a forest close by, then have them imagine this forest. Talk them through this forest. They will know, they will be able to create this forest of something they really know, they feel comfortable with, an environment they are very calm in. They're kind of creating this image and then asking them, go through all the senses, asking them what they can see, asking them what they can hear, feel, smell, and taste. So really engaging them in using all their senses, even if it just come down and listening to your story, to you talking. And again, there are audio guides to support you as well initially. But this helps a lot to build, again, this awareness, but also so this might be also a good technique to try when your child has a migraine attack, when they're in pain, when they are, for example, trying to fall asleep, giving them some kind of distraction in a way, but also very soothing and calming image. The next one is progressive muscle relaxation, PMR in short. You might have heard of it. There again are audio guides available online. And the basic concept is that when you breathe in, you tense a group of muscles. So for example, here in the image you see, they start with the face or using the arms. So even you could do it now. I'm sitting there, just stretching out your arms in front of you. And when you breathe in, really tense your arms, tense your hands, and keep it very tense for a few seconds. And when you breathe out, you release all the tension, you relax them. And as you might feel, and even if you don't feel it immediately, I mean, if it's the first time you're doing this, there's a lot of practice, a lot of repetition also involved, but you will feel your blood kind of through the veins again, and you can become aware of what it feels to relax this part of your body. And as you repeat these exercises, this relaxation, this kind of tension and release of tension again and again, you become aware of what your body feels when it's totally relaxed. And whenever you then are in a certain stressful situation, maybe, and you feel, oh, my arms, I'm just kind of tensing my arms, I'm making a fist because I'm super stressed, and you will be more easily, or you have better control of releasing that tension if you go through progressive muscle relaxation for a few times before. So that is really a great exercise. Again, there are a lot of audios in different length. And I do also have a script for children specifically. So I'm happy to share that with everyone who is interested. It often can be a quite boring exercise if you use the 40-minute audio available on YouTube, but there are shorter ones. I can share mine and we can make it a bit more exciting, but it's a good thing to sleep with. One more part on building habits, especially as kind of it's hard to build a routine for all of us, no matter what age, where in your life you are, if you're a child, a teen, if you're a parent, if you're an adult, if you're an elderly, whoever you are, it's really hard to build habits around these relaxation techniques. And they often, ideally, of course, they should be used in before. So as a prevention, kind of you learning these strategies, you learning, for example, for relaxation, doing again and again, so that when you tension, when you feel, okay, you're in a stressful state, your whole body's tense, you have better control of how to relax it. But for that, of course, we have to practice that before. And I'm conscious of time, but kind of the 4 tricks I still want to share with you before we move to any questions on how to build habits. So these are really some from behavioral research, some from habit building research around habit building, and they're quite simple. So the first one is to make the habit obvious, which is if you, for example, want to build a routine on guided imagery, and you always, when you're doing a guided imagery or one of these exercises, you have maybe a mat, a nice pillow, and this used to lie down, maybe a nice bed. And if you store all these tools in front of having them close by, preparing them maybe the night before if you want to do it in the morning, to really making habit more visually obvious, that might help you to engage with it a bit more often. It's like putting out our running shoes in the evening if we want to go running the next day. It might not work all times. Another thing, habit obvious, is this very simple sentence you can use where you connect a habit you're having to a new habit. So for me, for example, I'm doing really every day, I take 10 minutes in the morning to do some yoga. This is it's kind of a meditation for me, because it also calms my mind. It gives me a fresh start, but also it helps a lot with the tension I have in my body. And this I started by saying, okay, after I'm brushing my teeth, this is a current habit. This is something I will never forget. This is so trained already. That's standard for me and probably for everybody else to brush their teeth in the morning. After I'm doing that, I will do my 10 minutes of morning yoga in the living room. So again, making it very clear, very specific on what you want to do, when you want to do it. So this is a simple sentence you can put on a sticky note together with your child, write down something they're doing anyway every day, and there will be. So maybe start first, create all habits you're doing already, and then you can try to add a new one to that. Maybe about meditation, maybe about breathing, maybe about yoga, whatever kind of strategy you want to start with. And definitely start simple with one technique maybe, and don't start with a 40-minute audio file on meditation, but maybe just 2 minutes, 5 minutes, to really keep it small as well. The second trick was making it attractive. So tracking your habits, especially setting, also making it a competition. It shouldn't be, of course, too competitive, but if each of your followers picks, or maybe if you pick the same together, of doing a few minutes of meditation, of breathing exercises every day, then you kind of compare who did something this day and then make it more interesting. Make it easy as a first. All these New Year's resolutions, as we know them, there's a huge list we want to kind of do for the new year, but it's easier to start with one thing. And as soon as you have a certain routine with one area, with one breathing exercise, maybe with one guided imagery exercise for a few minutes, then you can slowly start to increase the timing or the frequency of doing that. First, make satisfying. As with all these techniques on relaxation, there's a lot of practice involved until we really feel something and it's working, and we see, okay, now really with all the hours of meditation I did, there is an outcome. So it will take quite a while to feel something, although kind of each practice, even if you're not immediately feeling better afterwards, is a big step towards building this habit, towards kind of building this preventative aspect of managing migraine. But because it's often tricky to see that immediate effect, and especially for kids and for for teens, it's hard kind of to grasp that or think about the future. It's really also about rewarding yourself, treating yourself as you're building this habit. And that probably every family will have different approaches to it. Of course, what is nice when you're doing, for example, also more the competitive approach where the whole family is engaged in a exercise, in a new meditation routine, for example, then also have some reward for the whole family. I'll jump to that again, just a recap of resources. So you can definitely try the app, which at the moment you can do kind of the symptom tracking and the mood tracking part, and then also getting insights in how the mood and pain attacks might correlate. It's in the early stages, but we welcome any feedback to improve it. It's also for free. Other resources, we have a blog, we have social media, we have a parent online course as well with more topics, not only on the kind of self, but also kind of the general education around migraine, on different medication, on people who you could see or who you might want to see for more concerns. So there's kind of the whole range of from biological aspects to self-management techniques. So happy to reach out if you need anything from that. And also here are my contact details. If anybody has very specific questions, just wants to talk through their situation, get some tips around that, please feel free to reach out.